Early morning at the Cape Town High Court, where of course submissions will continue this morning by Advocate Andrew Breitenbach, representing Minister Nkosazana Dlamini-Zuma, British American Tobacco. Now, of course, yesterday British American Tobacco submitted to the court that they're challenging the ban of tobacco and tobacco-related products, the sale thereof, on the basis of constitutional rights. Now, let me just refer to my notes for a moment. Advocate Alfred Cockrell for BATSA said, among others, these constitutional rights include the right to dignity, privacy, and the autonomy of adults to make decisions for themselves. He said even if a decision is bad, adults should be allowed and is entitled, according to the Constitution, to make those decisions for themselves. Now, he says in Minister Dlamini-Zuma's own words, the reason for this ban is that she wants people to stop smoking because, according to her and medical evidence that she and her team says they have, people who smoke stand a higher risk of contracting a more severe case of the coronavirus, and therefore might need to be taken into hospital and use ICU beds. So the reason for her to implement this ban is to get people to quit smoking so that more ICU beds will be freed up. But of course, BATSA says the only thing she's really doing, according to their submissions and according to evidence that her own team submitted, is that at any time she is only freeing up 16 ICU beds with this ban. They're calling on the courts, it's a full bench of judges that's hearing it, to seriously consider that this ban should be set aside, because Dlamini-Zuma is referencing the illicit trade as making cigarette prices so high that people will quit smoking. And Cockrell said yesterday that that is an extraordinary way to infringe on the rights of people's constitutional rights. In the late afternoon, Andrew Breitenbach for Nkosazana Dlamini-Zuma started his submissions. He didn't get very far into his submissions. He will continue today, of course, saying that the decision made by the minister was not made lightly, because she understands this is a matter of livelihoods versus lives. And he also said there was online surveys conducted, one in a higher income bracket, which showed that 16% of people had stopped smoking, and another survey that was also done online with lower income groups showing that up to 49% of people had quit smoking. He also said that there is medical evidence that people who smoke do stand a chance of contracting a more severe case of COVID-19. But we'll hear this morning what further submissions will be made by Nkosazana Dlamini-Zuma's team at the Western Cape High Court. Then, of course, the BATSA will be given a chance to reply, and it's unclear at this stage when there will be judgment in the matter. But BATSA is challenging the tobacco ban on the grounds of constitutional rights that were infringed.